Hey, welcome back. This is Dr. David Cruz again for Whitecoat Medicine, and today we're going to talk about your thyroid. When you come into the clinic and your doctor tells you you're hypothyroid or you're hyperthyroid, you may not know what that means all the time. So let's try to explain it in a simplified version here and see if it kind of makes a little bit more sense to you. First of all, what is your thyroid? Your thyroid is a gland that sits right in here in the neck area, and I like to explain it as it controls all the metabolism of your body. So basically, if it's working very slow, everything in your body that you can think of is going to go slow. If it goes fast, then everything will go fast. So if it's going fast, you're going to get symptoms like nervousness, insomnia, maybe some diarrhea, anxiousness, sweating a lot. You'll be fatigued. Yeah, a lot of people will lose weight for no reason at all. And so those are some of the symptoms that you would want to look out for. If it goes too slow, you get the opposite. You'll be very fatigued, tired, not thinking clearly sometimes. You'll start gaining weight. Your voice might change and get deeper. Your skin might get rougher. So those are some of the things that you'll have to look out for. Now, let's explain how this happens, is how your thyroid works. First of all, in your brain, in the pituitary gland, you get thyroid stimulating hormone made. This hormone goes down into your thyroid and it binds into your thyroid so that it can produce more hormone. And then that is released into your bloodstream, and that's the way you keep your metabolism going in your body normally. So normally it's a very easy flow. You produce this, it produces this, and then when there's too much of this, it goes back again and it turns this off. We call that a negative feedback loop, because the actual hormone will turn off this hormone so that it's not produced anymore, and therefore you don't produce more of this. And that's the way it works normally. Now, some people can get hyperthyroid, and there's different causes for that. It could be that you have Graves' disease. Graves' disease is sometimes when your body produces an immunoglobulin that will actually go and bind. It's going to act very much like this, bind to your thyroid. And when it binds to your thyroid, you start producing a lot of this. And then you're going to get all those symptoms of hyperthyroidism. And that's one cause of it. There's others where you get multinodular goiter, where you have a lot of nodules that will be producing these hormones. Or you can have one nodule. And those usually are not cancerous, but they have to be taken care of. There is a type of hyperthyroidism that we call subclinical hyperthyroidism, where you don't have any symptoms, but we do notice that your TSH is too far down, and we go, well, you are hyperthyroid, but you're not having any symptoms. Some of those people can come in with changes in their heart, like atrial fibrillation, which is a rhythm of your heart that is not very good, that can produce strokes. So we have to be very careful with that. Now, as we start talking about hypothyroidism, we talk about all your other symptoms that are exactly opposite of what you would get with hyperthyroidism. So now you'll be feeling fatigued, sleeping more, weight gain, your heart beating slow, very tired all the time, everything working slower, constipation, your voice getting deeper, things of that sort as well. So those are the things we'll be looking out for, and that you should be looking out for with hypothyroidism. Now, your doctor is going to give you medications if your thyroid is working too slow, just to replace the hormone that you're missing. And we usually start slow and take it slowly higher up so that you can hopefully get used to the medication, and then you'll start feeling back to normal, feeling more energy, feeling better. If your thyroid is working too fast, then there's going to be different tests that are going to be done to figure out why it's working too fast. That could include ultrasounds, it could include some other studies that they have to do to look at the thyroid better, to make sure there's no nodules causing it, because sometimes you can have nodules that are going to cause your thyroid to work faster, or you can have a goiter where your thyroid is bigger than usual as well. So those are some of the things that we'll be looking out for and studying. So your doctor will be on top of that to make sure that those are being studied to find out what's causing your symptoms. This is a brief explanation, and we'll go into more detail in other videos later on, but just wanted you to get an idea of what we're looking at when we're talking about your thyroid, so that you understand it a little bit better. And take care. Have a great day.